So, moving on to our special part of today's first half, we have put together a special panel on autism, which brings together various experts on one forum. We have Dr. Deepak Gupta, a renowned biomedical doctor for autism. We have Dr. Chandrasekhar, an expert in microbiota transplant in autism. Dr. Nandini Chandran, she's an expert in stem cell therapy. Mrs. Mini Dwivedi Gopinathan, she's a relationship development intervention consultant, and Mr. Praveen Agari, he's a scalar energy medicine expert. And this panel will be moderated by Dr. Ashwani Garg. He's a functional medicine expert working in the field of autism. And the topic that we will be covering in this panel would be what are the various tools, and which tools should be used when it comes to helping a child with autism. And then we will also cover various practical approaches for parents of an autistic child. So over to you, Dr. Ashwani, and I will add all the experts here. Yeah. Just give me a second. Please go ahead.
Thank you, Dr. Ruhi. Thank you so much. So first of all, I just want to have I appreciate all of doctors to spare time and spend with us on a Sunday so that we can create this awareness. And then, of course, at the end of the day, our parent can benefit. Okay, lot of time, lot of parents, just miserable lives they are into. And unfortunately, the answers given to them, okay, it's not possible. It is lifelong. It has to be like that. Whatever we are doing is fox. I think this is the most disastrous thing to start with. Okay, so I think I appreciate all of you that you are doing a fantastic job, and we put together, I think, there's a possibility to take care of this autism. I don't doubt it at all. Now, in India, I think this panel could be the far more advanced panel with their understanding about the problem and their kind of level of work all of the panelists are doing just in their individual capacity. Okay, they have built from this, and these things are not in the books. Okay, so don't expect that you go back, read some book and get out something out of that. So just spare some, except asking questions, just listen to this. I'm sure you will have a lot of your questions addressed, and I'm sure I will go back. I have written all the questions that you asked anyway. So thank you so much. So first question, I think I will go to everybody and allow you time so that in the first question that anybody will come to you or come to us, they ask is it something genetic or is it acquired? Now we know it is regressed, but I want to hear from you, and you take your time, maybe 5 minutes each. Dr. Deepak Gupta, you have been doing it for a long time. And what are your thoughts? Is it acquired or is genetic, or both? But what is the most possibility?
My take is very clear. As the numbers are increasing from 1 in 10,000 to 1 in 36, it cannot be genetic. Very clear. Now, if you apply the other factors and the theories also, the numbers would not have increased so dramatically and so drastically. And so that means there is something which is playing on. Now, also, when we examine these children, we don't get a lot of time those stigmata. Those stigmata are not there, correct? And we see there's a clear-cut regression. When I came back from London in 2004, and now 19 years down the line, I see more and more of regressive type of autism. And so the age of regression also have gone down. It has come down. I've seen children who have regressed at the age of 10 months. I've not seen a child regressing less than 9 months. So after around 10 months, 12 months, 14 months, 15 months, 2 years, 3 years, 4 years. Now I'm seeing children who have even regressed at the age of 4.5 years also. I've seen. So there's something is there in the environment which really, really hits them. Is it vaccine? Is it nutrition? Is it toxin? Is it stress? Is it a nutrition? or is it a combination of multiple factors which leads to it? So as more and more cases are coming, I can say, I'll agree with the figure what Dr. Chandrasekhar had presented, that around 10% or 10 to 15% may be genetic, pure genetic, and rest 80 to 90% have a genetic vulnerability may be there. That means their microbiota was susceptible, they had some genetic vulnerability they had, but then they had a very strong environmental factor to contribute, which led to gradual building up, and finally the balloon got busted, and finally and that is what the epigenetics is, and finally they went into features, some symptoms and signs suggesting of autism, and then they got the diagnosis. So this is what is my undertaking is that, and I keep on telling to this every fraternity and in every this thing, and even to the parents also, there may be some element, but environmental factors are very, very strong to play, and we need to address it. And as Dr. Chandrasekhar said very rightly, yes, a lot of precautions which can be taken before you conceive, during pregnancy, and after pregnancy, especially in the first 2-3 years, itself gives an answer that yes, there's a lot of environmental factors. And since I've been doing hard in this biomedical things and other interventions, I recommend a lot of parents, they ask me that when we go for the second child, what precautions should we do? I guide them what all they should do before conceiving, while after they conceive, during the first trimester, second, third trimester, before delivery, after delivery, first 1 year, second year, and God has been very kind that they don't have a second child with autism. So all this I can say, and with new papers coming in, a lot of articles, a lot of papers coming up, and yes, EMF, all these EMFs contributing, a lot of research going on. But by the time the research will come and we'll have conclusion, we'll have a clear-cut regulatory body stamp on them, children would have been impacted. The figure would have gone to 1 in 10, unfortunately. That's what has been speculated. The figure will go up to 1 in 10 very soon, in next 5 years. So that is what my answer is, that yes, environmental factors is a very, very strong contribution to the etiopathogenesis of autism and spectrum disorders.
Thank you, Dr. Gupta. So, Dr. Nandini, now a lot of parents, they ask us, now one of my child has a problem. Shall we go ahead with another child? Or just because somebody has told us our genetics are bad, shall we just not go ahead and get another child? So what are your thoughts and, solace to those parents?
We encourage parents to have another child always. We believe that, in fact, we have seen that children with autism who have siblings do very well in terms of their development. The children, the neurotypical child, the brother or sister contributes a lot to the social development of the child. So yes, we strongly recommend, but as very rightly pointed out by Dr. Gupta, that we have to take some measures. We also counsel them regarding doing genetic workup if that is the worry, because most parents worry whether it is a genetic condition. So it's worth looking at whether there is, and if it is not, I believe that yes, completely agree on all the points that Dr. Deepak Gupta said, that environmental factors play a major role. And my point is, if there is a genetic problem, really, what can you do? If you're hypertensive, you have a family history of hypertension or diabetes, you can't really change your genetics, but you can change or you can modulate your environment. So the environment may be the environment of the cell, right from the mitochondria to the environment of the person where he or she lives in. Because we have seen children who are like triplets, who are siblings, a lot of twins having coming up with not only with autism, with other neurodevelopmental conditions as well, but their manifestations are different. They are not identical in the way that they express. So definitely there are factors, whether you call it epigenetics, whether you call it environmental, whether you call it the respiratory chain, or everything which is influencing the final outcome. So even with the same genetic makeup, you can have a mild child and you can have a very severe child. So yes, you must work on the environmental factors. What we believe is that the mother, one, has to be emotionally, physically, as well as, in terms of her overall approach, should be healthy. So wellness is very important for the mother. yes, all the physical workup, like I tell them, do the complete blood workup. Look at your iron levels, look at your vitamin D levels, look at your B12 levels. Check out for torch infection. I think sometimes we just forget about that. And look at your HbA1c levels, look at your thyroid TSH levels, look at all of that. And yes, if all of that is good, improve your nutrition, do good exercise, think good thoughts. We tell the father that if you don't want to have another autistic child, keep the mother happy. So stress, yes, try and keep the stress down. The stressors are there everywhere, especially with the nuclear family setup. There is no more joint family. There's not so much support. The mother and father have to do everything, especially in the urban population. So find a way to get your body to de-stress. And having another autistic child, you will be stressed. So find a way to get beyond that. And then especially during pregnancy, eat well. After, and one more thing which I know it's controversial, but something which we do talk about is the radiation from the phone. So try and keep the phone away from you as much as possible. At least don't keep it near the womb. And so screen time for the child is less. Screen time for the child is important, but less screen time for the mother is equally important. So these are the things and yes, you should have another child. You should have another child, but you have to take care and don't stress out. That's but it's easier said than done. I understand.
Fantastic. I think at least they should not be scared. There are ways they can get another healthy child for sure. Everything is not genetics. Thank you so much for pointing that out. I think this gives a lot of hope to the parents. There are answers to autism, but at least to getting another child in a healthy way, certainly possible. So Dr. Chandra has his personal story. He turned from a cardiologist to FM expert. So Dr. Chandra, we see a lot of mothers, okay? They have some autoimmune problems with them. They have some fungal infections with them. They have some Clostridia infections with them already.
Yes.
And unfortunately, when they come to us with a child, and then, okay, they also had a problem, and we start working with them, and we find all of these problems. So do you find a correlation that a mother having not, in the right state of health can lead to a child having these problems?
Yes. I'll remind you I'll give a heads up about two important facts. One is thalidomide tragedy. So we have seen in the 1960s, one molecule shattered the embryonic development. The first thing. The second thing, so if you go and look into in our childhood, we used to see lots of earthworms. Wherever you go in the field, now it is not there. So if you go, what is happening with if you go and study what's happening with the earthworms, you will understand that the high pesticides and weedicides we are using it's impacting their reproductive health, and it's their growth as well, their overall health. So the same thing is happening with human beings as well. That's why you can see infertility centers growing, autism growing, like earthworms are getting extinct. Human race is going to extinct in another 100 years. So the similar thing, like the mother is the medium for the baby to develop. So if your mother is not healthy, then the child has high chances of getting into the trouble. So that's why we have to intervene during the pregnancy itself. So during the pregnancy or before the pregnancy, even before marriage. It is very impossible to bring a couple who is not having any problem to the clinic for autism prevention. But this campaign has to go actually. So unfortunately, we are living in a toxic environment. We have shattered the environment completely, and we are eating a lot of pesticide. What's happened with the earthworms, and it's happening with human beings now. So mother health is very much important. Detoxing the mother and improving the mother's gut microbiome will improve their autoimmune condition. Like gut microbiome, we know that directly has signal so the entire microbiome is like a gatekeepers for the human body. So I always say that human body is a closed chamber of biochemical pathways going on, and the microbiomes is like a security to this chamber, and whatever the environmental toxins, whatever environment factors that are entering into this chamber, the microbiome will read them. So if the microbiome is bad, then it will report the immune cells. So 80% of immune cells are in the gut lining. That means There is a gatekeepers outside the lining, the mucosa, and there is like gatekeepers just inside the lining. So anything that enters this closed chamber will have to pass these two gatekeepers. So this like microbiome is one gatekeeper and the immune cells are the other gatekeeper. These two have crossed out. So that's why autoimmune diseases occur. If you have bad microbiome, you will automatically land up in immune disorders. So if you correct this, if you detox them, if they detox the mothers, if you modify their gut microbiome, immune regulation will happen, and autoimmune disease will come down. The pregnancy is also a physiological process; it's a physiological phenomena, and from zygote to total embryonic development, everything has to be right. So the entire epigenetics has to be right. The mother's medium should be in a proper way, in such a way that the embryo will not have any problem. Embryonic development will not be having any problem. That's why the gut microbiome modulation and detox are the key factors. If you go before pregnancy, then there is high chance of getting a normal child.
All right.
This is my perspective.
Sure. Thank you. So I think this is very pretty clear from FMT expert that a lot of autoimmunes are happening because of deranged microbiota, and that is contributing to autism also. There could be so many other reasons, but this is one of the primary issue causing a lot of problems. So there is hope at the end of the tunnel. So I come to Mini now. This is very, very important. Autism as a diagnosis itself brings a lot of pain to the parent, but then it's always told that early you diagnose, which is good. You diagnose early is good, but then after you diagnose, you do therapy. Okay, that is what is told to the parents. Now, is therapy enough, or it can become counterproductive if at all? In your experience, you have been doing it for so long, and you have your personal story. Or are we missing the train? You diagnose, which is good, but that you don't take the right steps, and which can be counterproductive. So, what are your thoughts on that?
Thank you, Dr. Garg, for bringing me here and asking this important question. See, right now where we are, still we are not able to prevent autism. So all of us are still in the curate, where we are trying to provide services after the child is diagnosed. We are not able to prevent it. Now, even for a typically developing child, the parental role is always very important, which contributes in the overall growth and development of the child. Physical development happens on its own because of good nutrition, but mental growth, the mental development, it completely depends upon the environment in which the child grows in, how nurturing the environment is. And that nurturing always comes from parents. So in the first year of life itself, the whole relationship between parent and the child is very natural and very contributive to each other. Parents grow the children and children also grow their parents. So the kind of energy the children bring keeps parents on the roll always. I mean, parenting is the most difficult task. We all know it, right? So, but unfortunately, when children are diagnosed with autism, because autism starts in utero, they're born with it. So because of the vulnerabilities, epigenetical changes, or whatever we are talking about in this conference, the children are not able to take the advantage of their parents' unique relationship with them. And that unique relationship is what we call as a guiding relationship, where just the presence of each other, the very strong motivation to grow each other self, and it is not conscious. Like child does not grow the parents consciously, but child's actions, child's demands, child's inquisitiveness, child's exploration, all those things becomes a fuel to parent also to move for their child. So this entire guiding relationship is completely missing. And even when the child is typical, and if this guiding relationship is not present, we see different kind of children, right? So it's not just because of autism, but otherwise also, if the parents are not able to provide that guiding relationship for because of whatever reasons or situations, we see that the growth takes in a different direction. Same is applicable to children with autism also, because they are born with a vulnerability. They really cannot drive their own growth, their own mental growth. So it becomes even more important for parents to learn to play the role of a guide in a way that can nurture the child. And that's what, like, relationship, when we talk about relationship-based models. So we don't see child as a behavior. Every behavior, what we see it as a communication. Communication at a sensory level, communication at a motor level, communication at a regulation level. So communication at at like at the cognitive level. So we build a relationship with the child where we see every behavior as a communication, and instead of changing it, instead of trying to change that behavior, we bring that guiding relationship in, where we again help the child to become inquisitive, learn to observe the around, the surroundings, the environment. And the main thing, the main principle of guiding relationship, or forming the guiding relationship, help to switch on that button of the child where he learns to learn on his own. Because
Right.
otherwise, where all the therapies lead to, you each and everything you have to teach your child, and not just one time, like 100 repetitions and for lifelong. So every small thing you have to plan and you have to teach. And I hope you all are with me in this, that one lifetime is not enough for us to teach everything. 80% of the learning in human beings is implicit. It just happens by just seeing, by just experiencing, by just witnessing. And it just takes one attempt for a child to learn it. And uh, that nurturing environment enables my child to do that. So the
Right.
guiding relationship is so important for parents to learn that. Now, what happens that moment a child is diagnosed, the experts, they say, keep stimulating your child, keep stimulating, keep using language, keep using language. We don't realize that when we try to teach too much to our children, first thing, we come out from a role of a parent, from a relationship of a parent, we get into a role of a teacher. Teacher's role is very, very different. Like, teachers has to finish his curriculum and help the children, help the child to pass the exam and move to the next grade. That is not what parents are supposed to do. So what happened? The teaching role is very stressing for the child as well as for the parent, because the child is being taught every time, every single thing. The way child learns is that I do not know anything. Everything needs to be taught, and I become dependent on someone else to teach me everything.
Right.
So this self-exploration, inquisitiveness, observation, learning on their own, that whole circuitry does not develop. So the neuroplasticity, what we talk about, where we can actually, because of the neuroplasticity, we can help children, and we also they're very like neurons which fire together. So we can actually create that whole neuronal system for child to develop those connections where they have a sense of competence that I can do it.
Interesting.
That leads to intrinsic motivation, and motivation is a guide. It's a guide to regulation. And when children are regulated, they can learn better.
Absolutely.
The other factors, that is also very important thing, which mainly I focus on. Another thing I want to bring is early motor foundations. So whenever a child is diagnosed with autism, at the age of 2 months and 3 months itself, we start seeing that the way motor development should happen, it actually goes very way off. And those foundations are not developed, leading to a lot of things which we have been talking about.
So in a nutshell, you're saying, before we want to train our child, we want to make the brain capable enough to understand what we are saying and start reciprocating, or rather they can learn from the environment.
Yes,
it's not
and
always necessary.
Absolutely. And for that, parents have to slow down a lot.
Yeah.
The crux is in slowing down, not
So we
talking
cannot.
entire day in front of your child, slowing down.
Yeah.
So
Okay.
this is what we call as co-regulation,
Right.
where the child learns about himself through the experience and eyes of caregivers by experiencing it.
Sure.
So
Thank you.
this is
Thank
something
you.
like I really am trying to focus on and trying to spread this word across, so that don't stress yourself.
Thank you for the concise information to the parents. So, Dr. Deepak, I'll come to you. Now, a younger child is diagnosed and put into therapies without any medical intervention into it, which is taking care of the infections and toxins and nutrition, etc. So people expect that the status quo will remain same. If my child has a problem of 30%, or the child is mild, it'll stay mild because I'm doing therapies. It'll stay moderate if I'm doing therapies. So what is your information to them that, is good to have early diagnosis, but intervention is important, and the disease can progress and that diagnosis can change. So what are your experiences, and of course, what would you like to tell to the parents?
See, my thing is that I'm always pro therapy. I'm a believer in early intervention therapies. But my thing is that it should be a combined approach. My approach is that start with basics, start with basic supplements, start with diet, start with gut healing, investigate the child. If possible, you can do it, because a lot of people in our country have cost issues, affordability issues, and we have to manage our own home, we have to manage therapies, we have to manage we have to pay your fees, we have to pay for supplements. So it's a little expensive. So we don't have to very rigid. I'm not a rigid practitioner. I'm very, very flexible practitioner. And so my thing is that I always say the combined holistic approach, where parents are also trained, as Minnie was talking about. Parents are trained, parents are empowered, the blame, guilt are taken off. Therapies, yes, good competent therapist is very, very important to work with the child. And the third thing along with that, addressing the various needs by investigating, by diets, by biomedical approach, by working on their needs and requirement, by deficiencies, which I talk about 3 R's, removing what is harming them, replenish what deficient in them, and restoring the functions, what are not working. So my thing is that have a combined approach. And yes, coming to the mild, moderate, severe, I'm not a big fan of that. A mild, moderate, severe. I believe that every child has strengths and challenges. So my thing is to identify, because before 3 years of age, this mild, moderate, severe does not hold at all, according to me. And that is the time, as even Dr. Nandini was talking about, the earlier you intervene, the better results. So the children who have been under my care, who have recovered, the most of them are less than 3 years, 4 years, when we worked on them, who have recovered now completely. And when we started working with them at age of 1.5 years or 2 years or 2.5, 3.5 years, that is the time when we saw. Beyond the age of 4 to 5 years, we saw improvement, but they have not recovered. Beyond 10 years of age, we have seen children who have shown improvement in symptoms, but yes, their levels have not improved, but they have become more functional. So in that way, their functional capacity, their ADLs, their quality of life, QOL, they all became better. And that is sometimes after the age of 10, 12 years, when a parent is living with a child with spectrum and having a parent or have been parenting of 12 years, 15 years, for him, the diagnosis and severity does not matter. For him, the important thing is that the child should be happy. There should be a peace at home. The quality of life of the child should be better. He should be functional, and he should be ready for the vocational training. How you do it, how you manage it, yes. So answer in a nutshell is that a combined approach, a holistic approach, where I think that what happens is that some people say so much negative against one modality. Some people say negative modality against this thing. A lot of parents come to say, we have been doing therapy for 3, 4, 5 years. We are fed up. We have not got results. Can we try biomedical? Will it help or not? So all these are very difficult questions to answer, let me tell you. So that's why I always say, the earlier you start, the better it is. Don't worry for the big diagnosis and big labels. If you see some challenges, start early. Don't wait till the time he'll become 3 years, 4 years, then you will get an official diagnosis and you will start. So my thing is that, earlier you start, the better it is. Have a comprehensive approach. Read about it yourself and do ask questions from the doctors, and then educate yourself and then work step by step.
That is interesting.
Don't be blind. I always tell to them, don't be blind, maintain a diary. If I've heard about from Praveen about scalar energy, read about it. If you think it's hope, talk to him, try step by step, and then see if it's working for your kid. Maybe the scalar energy will make a difference. Like stem cell, a lot of people ask me for stem cell. A lot of people means a lot of people ask me. And a lot of clients under my care go, and I never stop them. But I do tell them yes. And I do tell them yes. They do ask me about what letter came in 2023 January. They do ask me about that also. But I tell them yes, it do help. There are a lot of scientific evidence is there. But if you can afford, if you have affordability, do try and talk to the team. It may help your child. Every child is unique. So the unique variability of each child should be respected. And it's one thing in autism is that if autism would have been so simple, if epigenetics would have been so simple, I'm sure the numbers would not have increased so far.
Yes.
So despite all these things and despite everything has been there in the world for so many years, despite biomedical interventions for more than 3 decades, despite therapeutic interventions being there for so many years, despite all the energy healings have been there for so many years, stem cell has been there for so many years now, still the numbers are increasing. There's something is there still missing. That's what we.
Right. So maybe the karmic patterns.
I think that's a different chapter, karma and sanskar. I think we can talk some other time, but yes, that's not a part of it.
So,
But yes.
in a nutshell, you're saying a multi-approach, and you as a parent has to learn about it. Just don't be only dependent on somebody else. You have to learn, you have to do it yourself. You speak to different practitioners where you get tuned to, stick with that. And it is a complex problem, multifactorial problem. It is going to take some time, but certainly doesn't matter where you start. At the end of the day, some improvement, the starting point will move, the needle will move, and things will improve, is what Dr. Deepak in a nutshell is saying. So fantastic.
Every child can improve after working with difficult to different, severe to severe, complex to complex cases. Children do improve. I can say that.
Thank you. Thank you. So Dr. Nandini, now I saw your slides, and I also work with a lot of metabolic disorders, mitochondrial augmentation. So it's clearly a metabolic dysfunction where mitochondria is not enough, or cells are not enough, or are not optimally functioning. Okay. So at the end of the day, the brain has less of the energy production basically happening as a result of all of these things. So what are the different things that you do to enhance this mitochondria?
So yeah, before I answer that question, Dr. Ashwani, thank you for bringing all of us together, because everything that Miniji has said and Dr. Deepak has said resonates so much, and this is exactly what we tell our patients also. Now, yes, we believe, of course, that everything, all of this, your external factors do matter. Gut is a second brain, right? It is one of the biggest another second nervous system with so much of nervous system connection. But yes, the brain also is important. So as I said, there are certain parts of the brain which are functioning less now. These are metabolically low functioning, and that we come to know from the use of the PET scan that shows the glucose metabolism, that because the glucose is the energy that the brain uses. Now, improving the brain functioning is what you have asked, right? How do you change that, right? So one is, of course, the cellular therapy. The other is the oxygen-based therapy. Hyperbaric oxygen therapy combined with cellular therapy, we find that because the increased oxygenation also helps in improving the respiratory chain. It stimulates the mitochondrial respiratory and stimulates the stem cells in the brain. I read one statement from Dr. Chandrasekhar's presentation. I think that the metabolites or the supplements which are given also stimulate the stem cells. So everything finally is that you need to stimulate the stem cells in the gut, in the brain, in the body to be able to function better. And as the brain functioning improves via oxygen-based therapy, even ozone therapy, we have seen that gut ozone helps beautifully for improving the. It is a natural germicidal, so it helps remove the gut toxins as well. So all of this together, and as the brain functioning improves, then the rehabilitation, we believe, works better. What Miniji was saying, that the child needs to learn by himself from the surrounding. And how do you empower the child is by improving the brain functioning, and that's our aim, to improve the brain functioning. So the child, instead of you teaching the child all the time, initially, yes, you need to sort of prime the child and give a guidance, but eventually he or she needs to take information from the surrounding. He or she needs to be able to process information that is coming in, processes appropriately. I think what we see is inappropriate processing. That's where we say hypersensitive or hypersensitive. So it is inappropriate processing, and that's where we see the thalamus is important. So all these different parts of the brain, when they start functioning better, and then with the training you start networking them better, then the information processing and response becomes better. So this is that's why we also believe that it's a teamwork, and we need there is no one Ramban Upai. It has to be a combination. And yes, for every child, some combinations work, and for some it doesn't work, right? So yes, and we have had the patients, and thank you, Dr. Gupta. I've never had a chance to meet you, and this is like a virtual, and I have seen many patients coming to me saying that we have gone to Dr. Gupta and we have asked him, and he said there's no harm in trying. So at least that approach, I feel, as you said, look at it and understand your child's need. Understand every child needs different things, and put together a team which works together with each other. That's what I said. There are hundreds of things, but how do you choose? That's the parents' question. How do you choose what to do? So look at your child. What are his problems? How do you address each, or how do you go to the root of what his issue? Some may have a lot of sensory issues, some may not have sensory issues. We have seen, I travel all over the world and I see different kind of manifestation in every part of the world. Like in some parts, you don't have so many sensory issues. All you have is a lot of communication issues, or speech is delayed, but they are otherwise well. So, every child is different. Look at the child's problem. And I think also as medical caregivers, we need to spend time with the parents. I feel that is something we need to give them time, understand the child's concern, and lot of parental counseling. My God, of course, lot of parental counseling to, yes, limit your expectations, work with your expectations. Don't put your expectations on the child. Let the child grow, be the best person that he can or she can. Get the potential of the child out, and don't put that he should be like other children. I said, your child may be much better than other children. We have seen beautiful abilities in children that we have treated better than other so-called neurotypical children in terms of reading, languages. There is a child who learns languages, God knows from where. So these harness these potential and guide them. Very rightly pointed by Miniji that normal children, neurotypical children also need certain kind of guidances, and they also have their issues. So in every child with autism, there is a child. Don't forget that child. Just don't think that everything is autism. So yes, I think that, and yes, of course, the mitochondria, the brain functioning, everything has to be improved. Yes, but with the combination.
Thank you,
Combination
Dr.
is the
Anil.
key.
Yes, so I think this is important for parents that you have to work on the biology upgradation. Biology has to become better. Okay, and for that, diet, water, HBOT, stem cell, what may it take? Okay, we don't have a easy option, unfortunately. You have to do what is required. And nowadays we only have one child or two child. You have to do what is required. Please don't give up. Okay, there are ways, and so many doctors are putting so much effort just to bring it out to you. So kindly stick to it. So Praveen, I'll come to you. Now, Dr. Deepak has said numbers are increasing, and genetics remains constant fairly. So in your experience, then you start detoxing this or that. Now, what environmental changes that has taken over a period of time? If you compare, let's say 40 years back or today, what all things that had changed today in the environment? And then when you detox these things which are present, maybe chemically we're not able to test, but at least when we give a frequency and there's a reaction, that means it is there. So what things are there in your experience which are contributing to rising numbers?
I think if at all we go by what I've understood and spoken with parents, and the time frame seems to be around, say, let's consider vaccination or other exposures. So what I understand, I think, is initially there is an exposure, say, of some additive in the vaccines or something, say, or anything. So that starts that makes the it helps makes the breeding ground for pathogens. You get a toxin inside, aluminum or mercury, thimerosal or something like that, which were not there before. So the increase in exposure to these toxins. Next is the immune system is fairly ready to do this even at this stage. I think the immune system starts breaking down as soon as we consume foods with glyphosates and other pesticides and herbicides. Until then, the immune system may not be able to kill, say, small bacteria or small bacteria. As soon as the immune system starts dropping with more exposure and other things, then it cannot kill parasites. So once that can opens up, it is more toxins and more pathogens, and the detox pathways start clogging up. The liver starts clogging up. We see once we start cleaning liver, things change. Many times with the kids, there is methylation issue. There's not enough methylation available for the methylation required for the detoxification. What we're seeing is if we give that also, the detoxification starts increasing. So it's if we probably the pathogens were always there, but the toxins were not there, and the toxins started invading us, and that became a breeding ground. And over that now the 5Gs and the radiations, especially the fungus is acts very aggressively once it comes in contact with these radiations. So until and unless we are able to somehow stop this or basically make a maintenance lifestyle change to avoid these, or try to detoxify and then make arrangements according to maybe exposure or something like the situation seems to like will continue, looks like will continue in the near future. Yeah, environmental, too many environmental toxins and too many environmental pathogens breeding, just taking out our immune system to even make that effort to make a fight to get these things done. And there is also genetic, obviously, say that 10% is the thing, Down syndrome or the Williams syndrome. But other than that, it's mostly induced. I think we have a great chance to get them reversed. But yeah, it's a continuous work. It's a persistent, long. You will have to give a long time to make these things work. We may not see the results initially. It will take time, but eventually we
fantastic.
can.
So you're saying the number of toxins are increasing, and number of radiation the system is exposed to is increasing, and radiation, 5G, 4G, cellular network, the satellite network, is Bluetooth, all of them can lead the susceptibility to grow more infections invariably. Not that we get infected, just kind of environment we impose ourselves to can lead to maybe a poor immune system or just growth of these infections, especially this if it's a more buildings with the water, they grow more fungus, more radiation, more fungus. So and that fair. So I'll come to Dr. Chandra. Dr. Chandra, now we come to specific questions asked by the parents, and they keep asking us all the time. And like Dr. Nandini says, parental education is quite a task. And of course, they have to be told all of these things. It's not easy for them, but they have to wait. Now, one of the typical things they keep seeing, as you are a microbiome expert, now during full moon, the hyperactivity is very, very high. And when they do albendazole, when they do any deworming, they seems to have a better outcome. So looks like parasites at the play. So what are your thoughts?
Yes. So even the microbiome has these lunar cycles, like parasites and all. Parasites to play a role. We have to do deworming regularly for these things. So I'm in the same lines with Deepak sir and Nandini ma'am. So I'll try to put it in a proper way, in a precise way, small for the parents. Like if you have a child with autism, so what you have to do is the first step is to detox them. The second step is to address their deficiencies, functional deficiencies, because there are multiple epigenetic errors and multiple deficiencies that you need to do, supplement them. You have to correct their microbiome, whether it is type modification, whether it is FMD or anything, so prebiotics, probiotics. Then you can go for regenerative medicine. These four strategies put together, they will definitely improve. Children will improve. So what we are trying to do in the regenerative medicine in Hyderabad is we are trying to extract exosomes, and in that exosomes we have seen some regulatory genes like the smaller RNAs. So which can actually go and stimulate the neuronal cells which are stagnant in the neuronal differentiation. So that can actually improve the child brain to mature. These 4 strategies can help actually. So for the children like who asked for these lunar cycles and all, so you do a bowel cleanse, do deworming, and correct their microbiome. These aggressions during lunar episodes, like this will improve for sure.
Okay. Sure,
Sure.
sir. Thank you.
Thank you.
So, Dr. Deepak Gupta, you mentioned that typical if chewing is there, then parasites are there. If ticks are there, streptococcus is there, viral infections are there. So similarly, so seems like all the symptoms the child might be presenting could be due to underlying issues their body has. Now, parent keep asking, speech is not clear, cognition is not great, behavioral issues are there. So they expect some different answers for everything. Or you would say that it's a one thing that we have to keep doing sustainably. So what are your thoughts on that? So we keep addressing differently or just a holistic way?
What I do in my practice, let me tell you, and what I've learned from some of my mentors in US is that every behavior or every symptom which parents present, there is a biological basis to it. It's only we have to put them together. We have to put all the pieces of the puzzle together and try to identify. Now, there may be oromotor issues. There may be chewing issues. There may be blowing issues, sucking or spitting issues. There may be incontinence. There may be bladder and bowel issues are there, which are still not controlled. Maybe there must be a sort of an apraxia, dyspraxia, which may be causing it. Maybe we need to work on we need to support a little more mito support, and that's where we need to work on it. Or maybe just oral apraxia may be there. So we need to work exclusively through using certain supplements like, working through omega, vitamin E, or, like phosphatidylcholine, which works on that particular thing. Or maybe something, or maybe the child is having the sleep issues, which is due to maybe because of gut issues. And we are giving melatonin and we are giving other things, but the child is not sleeping well. And once he addresses the gut issues, the child settles. Or maybe he is having allergies, and that leads to high eosinophil count, and parasitic issues are there, high eosinophil counts are there, and the child have allergic issues are there, and with variations in change of weather is there, and you work on the allergies, the child's behavior settles down, he's less itchy, less irritable, and he's able to better sleep. So and again coming to is that the speech issues, and a lot of times, which is one of the important aspects of the autism spectrum disorder. Yeah, and you can't say, but if you can investigate and the parent can spend money, you can look through the various metabolic markers, you can look through the methyl cycles, you can look through the folate cycles, you can look through the other cycles and see that yes, somewhere those cycles are altered, and once those cycles are altered, definitely the DNA, RNAs, and the proteins will be altered, or the dopamine or serotonin and dopamine, all they might be altered. And then you introduce those molecules depending on whether you need to work on the folinic, high-dose folinic, or one of my favorite, which I use a lot of high-dose for leucovorin, which I've seen very good results, again, from 1 to 3 milligram per kg body weight. And then you work on that, and then you support this thing, or you work on the methyl cycle, and then along with, and then you start seeing that yes, the cycle starts moving on, and the DNA, RNA, proteins, it starts coming into shape. Or you need to see that in spite of giving the methyl cycle and in spite of giving all these things, still the child is stuck. There's something is there. Maybe it's heavy metal, which is still blocking up, and then you investigate the heavy metals and you find the lead and aluminum, they're rocking, they're high in the blood, or they are high in the hair, or they're not that high in the blood, but they're still very coming out in the hair. That means there is quite stored in the body. And then you need to work it out that way. Then you decide with the parent whether you want to do some natural chelation, or you want to do some low-dose chelation, or you want to do a proper chelation, depending on the comfort of the parents. Right. So I always give them the option, and I tell them, okay, you pick it up, because in the end, I want them to be comfortable, and the people would have read so many things and would have come. So I want them to give time to take their own decisions. And if they have achieved all these things, and then do we need to work on the oxidative stress to particularly like icing on the cake? So all these things can be, and this all is guided by the investigations which we are doing it on depending on how much the parent are able to spend, or parent can be this thing is that. So in that way, we're answering this thing in a nutshell is that every symptom, whether it's sleep, whether it's itching, whether it's crankiness, whether it's stomach thing, everything as a reason why the child is coming out with it. So you can identify that, or whether it's a peripheral vision is there, or whether it's a regression along with peripheral vision, and there's some again the child is having a poor immunity and keeps on falling sick. That means we are suspecting a viral etiology. You get the viral markers, and one of the viral markers, I don't know if anybody has done or not, is cytomegalovirus CMV, which we see increased IgGs are very, very high in these children. And then you address them, you pull natural antivirals, or you push specific thing, and then they improve. Or looking for pandas, very, very common is there. So all these things you can identify. So every behavior speaks. Every behavior has a language and has a biological language also. So from people who are ABA therapists or people who are a specialized therapist, they will work through the behavior analysis, or they'll work through or sensory integrations expert will work through the sensory part. Okay, this sensory thing is there, but under that there is a layer of biological. Under that is a layer of genes, correct? So I'm trying to identify that biological component and trying to work on that. It works in some cases. Sometimes you need to put all the biological pieces together, and then you need to put mitochondria, you need to put heavy metal, methylation, gut dysbiosis, and then you see the whole puzzle starts sorting out.
Certainly, sir. Thank you so much. So I think, again, Dr. Gupta made it very, very clear. It's a complex problem. Multiple things are going in at a time, multiple pathologies, okay? And it's clinicians' ability and discretion to find out. There's no one way to do it. And beautifully put by Dr. Gupta that he goes with the patient's parents' ability, and of course, how much they can understand. You cannot, just snap a finger, fix all of these things. It's months to years of time. So it takes time. So I think, again, for parents, there is a reason why it is happening, and there's a way to come out of that. But there has to be patience with the parent. It's not easy, but it has to be. So, Dr. Nandri, specific questions for you, which some audience has asked. Can stem cell therapy be used for adult ADHD patient? You are on mute, ma'am.
Okay. Yeah. So when you say ADHD, adult ADHD, what does that really mean? That is the person, was he diagnosed early on and is still having those symptoms? So rather than the symptoms, we would look at what are the issues that he's facing in terms of being able to perform in his routine activities. Is that disabling?
I'll give you a little bit. So he has poor mental clarity. He's an engineer, established engineer, but mental clarity is not there. He cannot focus on things, easily distracted. And of course, to ability to perform tasks has deteriorated over a period of time.
Our experience is that ADHD, first of all, we would recommend to go with the conventional treatment. If already taken, like, yes, there are, because even in my family, we have ADHD, and my nephews have been able to outgrow that initially with medications and then stop the medication. But even if the medication is not helping, then we can review the individual based case-to-case basis. We would like to evaluate what are the issues, and maybe do a brain scan to understand whether really there is an organic problem or it is just more the neurotransmitters. So we would need to we could help, but we need to evaluate them. So if we can maybe
another question is, can stem cell therapy be done under the age of 2 years?
We have the our early limit is body weight. We need to have at least 9 to 10 kg body weight for the child. We have treated children who are yet not diagnosed but have initial red flagging of 15 months and 18 months also. So
Right.
yes, it can be done. Yes.
Sure. So I think now we are left with 6 minutes. I would give 1 minute to each panelist. Just a final thoughts. Dr. Chandra, what are your final thoughts? In nutshell, 1 minute.
Yeah. So 1 minute is very less time to address the very complex
Just final
issue called
thoughts, sir.
autism. Yeah. So my final thoughts are I told you precisely earlier also. So every child with autism, they have multiple deficiencies, and there is a neurotransmitter imbalance, and we need to address these two issues first. So then they will become comfortable. So don't go with the traditional understanding that autism doesn't need any treatment. They cannot communicate, but they do doesn't mean that they don't have any problem. So they have regular problems also, but you will not be able to understand what they are doing, what they are going through. So we need to understand their biology. So we do run schools, like I do run two schools for these kids, but so we apart from therapies also, I want them to look into the biology.
Right.
So and their biology need to be corrected. So
Right.
then their problem should be addressed. Even if simple things like I can tell you so the child may be having a simple ear problem or a dental problem. You will never be able to identify for months. You will miss out for months.
Mhm.
That's why you keep a track with some doctor and keep looking into their biology, and no need to do all expensive tests that I was mentioning in multiomics. So uh, so keep a track with a proper doctor, proper clinician, and always look into their biology. Always try to identify the problems objectively and keep sorting it out. So that is my advice for the parents with autistic children.
Sure, sir. Thank you so much. So I think the consensus is there among the panel that there has to be something medically done about it. So, Dr. Miniji, what are your final thoughts? Maybe 30 seconds. It's just running out of time. It's just too big a topic in 1 hour. Yes.
So let's understand every input which is coming to the body is sensory and every output is motor, even if it's blink of an eye. So sensory motor, understanding the sensory motor challenges of the child. So what is happening biologically is a parallel thread which is going on. But now to support the child, understanding their sensory and motor deficits is very important. And co-regulation is the way to go to connect to our children. Right. So, and of course, understanding the motor deficits, like say primitive reflex integration, which is the retained primitive reflexes does not lead to motor development. And let's understand speech is purely a motor act. Speech is just a motor act, but it's the co-regulation which brings conversation, the willingness to connect. The conversations come when we want to connect to people. Social engagement part, which is definitely a huge deficit in children with autism. So again, behavior should not be modified. Behavior has to be understood. As Dr. also said, it has to be understood from the medical point of view, and it has to be understood from the sensory and motor point of view, from the connection point of view. Again, it's a vast area, but parents have to, and it's like FMC or biomed. It's not that you just administer a medicine and the results are going to come. That journey is also tough for a parent. So parent also has to be equipped with all the tools to support the child and support themselves too. Their own mental health is also very important. So co-regulation, the relationship really play a very important part. Relationship with themselves, relationship with the therapist they're working with, relationship with their child, and understanding the sensory motor foundations are very, very important. That is what my take. I work on sensory motor and co-regulation, try to put it together.
But it's a fantastic, and the one point that you mentioned, that you cannot teach everything. We have to make them capable. Dr. Gupta, final thoughts.
You have a lovely theme. I was just and your theme is like hacking your own health for a long, happy, and healthy life. So a lot of emphasis is on your own health, and that's what I think parents has to say, that we have to be responsible for our own children and for own health. So I'll just put into ABC, which I put everything together. A is awareness. So be aware what is happening around the world. Be aware what is happening across the country, what is happening across the state. Something may be happening in north part of India, may not be happening in South India. So be aware, A. B, believe in yourself, believe in your kid, and believe in your doctors. Very important. And if you don't believe in yourself, if you don't believe in your kid, you will never believe in your doctor.
Yes.
So once you believe that your kid has certain challenges, once you believe what are your strengths and challenges, then you will work with your doctor. And that's important. So you need to work as a partner. We need to work as a partnership, a collaboration. There is no magic solution. There's no one-day solution. It's a journey. It's a happy journey. Work on it. And C is communicate and connect. Communicate and connect with parent fraternity. Communicate and connect with the like-minded people so that they can support you in every step. Because a lot of time when you take approach, you follow anything, or sometimes you fall back. But that's only a momentary of like a honeymoon effect. And after that, then you can again rise back and again move forward. So A, B, C. All the best. God bless us all.
Thank you. Thank you so much, the beautiful panelist. I really respect you. Thank you so much. And we finished this thing now. Over to you, Dr. Karishma. Thank you.
Thank you, Dr. Ashwani.
Thank you so much.
moderating
Thank you
it
so
so
much. And wishing all the best to every parent who has joined in this conference for the future, for the health of their children.